The Supreme Court is expected to rule next week on President Obama's health care plan, a plan with an individual mandate modeled after the one already implemented in Massachusetts. Tonight, Jeff Glor has the first of two reports on the plan that was put in place by Mr. Obama's rival for the White House, Mitt Romney.
When Mitt Romney signed health care reform in Massachusetts 6 years ago, his goal was simple.
Every citizen with affordable, comprehensive health insurance.
The key was an individual mandate requiring every citizen to get coverage or face fines. In his first presidential run, Romney defended the mandate as a personal responsibility.
Don't be free riders and pass on the cost of your health care to everybody else.
MIT economist Jonathan Gruber, who helped Romney design the plan, says insurance companies supported it because they got more customers.
If you want to tell insurers you can't charge the sick more than the healthy, you have to tell insurers, don't worry, the healthy will still buy insurance. Those two have to go hand in hand.
In the past 6 years, 439,000 Massachusetts residents who didn't have health insurance got it, many with government subsidies to buy it. The state went from 90% insured to 98%, the highest rate in the nation.
Do you want jelly or you want
School program director Andrew Herlihy enrolled in a subsidized plan that costs $272 a month.
I was always that guy who could dunk and was invincible, never gotten hurt in my life.
Until he blew out his knee playing basketball. The operation he needed cost $30,000, a cost he was spared because of insurance.
Worth its weight in gold, worth every penny, to me.
The penalty for not enrolling can range from $19 a month to $105 a month, depending on income. In Massachusetts, there is not just an individual mandate to buy insurance, there is also an employer mandate to provide it. Almost 80% of employers do.
So you think this could just change?
Bakery owner George Montilio is among those who don't.
If we had to put health insurance into our company, that would totally just make us unprofitable.
With 30 full-time employees, it would cost him $300,000 a year. Instead, he chooses to pay an annual fine of $295 per employee, or $20,000 a year.
Absolute mandate. I mean, that's just not right. I mean, we feel like, we should be able to make our own decisions to run our business.
Hospitals, like Boston's Mass General, are seeing more patients, but fewer visits to emergency rooms for routine care. Gary Gottlieb is CEO of Partners Healthcare, which owns 9 hospitals.
There's too great a fear of coverage reform and almost vilifying the experience that we've had here without really understanding how successful things have been.
Who made out the best in all this?
Well, right now, I think the people have made out the best.
However, in Massachusetts, like the rest of the nation, healthcare costs continue to rise. Jeff Glor, CBS News, Boston.
And tomorrow, Jeff reports on the costs of the Massachusetts healthcare law.